All right. Well, thank you everyone for joining us. So I'm Katie Bush. I'm in the Office of Global Learning and International Affairs. And we have Emily Davis joining us from CISI. So CISI is our travel insurance provider. So if you are on one of our faculty-led programs or an exchange program or a direct enroll, or your program doesn't offer their own insurance, you'll be enrolled through our plan. So Emily has graciously agreed to kind of go through the plan from the student's perspective and just be here for Q&A as well. So Emily, whenever you would like to take it away.
All right, well, thank you for coming. My name's Emily. I work at CISI. I have worked at CISI since 2008. So I've been around for a lot of different things that have come up in the world. And I am going to present today on the insurance and some of the tools and resources that are available, as well as information on, when you should use the insurance and how to use it. I'm going to share my screen. And don't think I can do that yet. I need to. Okay. See here. Okay. Sorry about that. All right. Can you see my screen?
Yep.
Okay. I'm going to turn off the video just while I am presenting. All right. So do feel free to stop me if you have any questions, okay? Okay, so once you are enrolled in the insurance, you're going to have access to a welcome email. In that welcome email, you're going to get an ID card, brochure, claim form, as well as a consulate letter. And you'll have access to a participant portal as well as a traveler app. Now, just real quick about the consulate letter. I do just want to say that there are some locations, Spain in particular, that require very specialized letters. So if you are going to Spain, you might want to check with the study abroad office so that they can make sure they get you the best letter for your particular consulate that you'll be going to. This is what the portal looks like. So once you have access and once you are enrolled, you will be able to go to the portal. And from the portal, you are able to do things like view and print your ID card. You can purchase an extra month of insurance for personal travel that is either directly before or after your study abroad trip. You can look at your online account information. You can obtain emergency contact information. You can also do things like update your itinerary. And also, if there is an emergency, you can mark a link that you are safe. You basically check in and you say that you are safe during emergencies. So I'll get to that in a second. So within the portal, as I mentioned, I just showed you the screenshot. There are a lot of different things that you can do. There's also an app that's available. And to get to that app, if you receive the welcome email, you can simply click on the Get CISI app and it will prompt you to download, the app. So you can do that, or you can actually just go and search for the app in Google Play or at the App Store, and you just search by CISI Traveler. Okay. From within the app, it provides travelers with a really easy to read home screen and really simple to navigate menu options. So the check-in, as I just mentioned a little bit earlier, that is to let your program and CISI know that you're safe when an unforeseen event occurs. You can also update your itinerary, which is basically independent of what you are enrolled for. So if your program is in France, you're going to get enrolled for going to France, but you might decide that you want to go somewhere for the weekend, go to a different location, and that's where that itinerary feature comes into play. View documents. This is where, you can email and view your documents. You can do all the things that you can really do within the web-based portal, but it's just a little bit easier to use, and you're probably going to use it more often because most students do. So it does have all that information there. You can save documents to your phone. You can do this to have access to it regardless of whether or not you're connected to a network later, which is really nice. So one of the things within the app is that you can view your documents, and there is a section where it says download all. And when you go to download all, the next time you get into the app, it'll give you the option to view those documents. So they get saved and you're able to view them. And so you can bring them up on your phone if needed, if you don't have a paper copy of the ID card. The itinerary feature in a little bit more detail. This is for us to more accurately pinpoint your location during emergencies. And so when it is utilized, it does allow us to help if there is something that happens. Now, so what you're going to do for the itinerary section is it's really self-explanatory. You basically just click on add from within the mobile app, add itinerary, and then you add your information and you press save. That will then pull into our reports. So if there is, typically what we're going to pull reports for that's going to be like political unrest or natural disaster in a particular location. Okay. So we will pull a report, and even if your program is in France, if you were in Italy for the weekend and something happened over the weekend in Italy, you're going to show up on those reports. So that's why that itinerary feature is important. The Are You Safe mobile check-in. So this is when the unexpected does happen. So if there is like a political unrest situation or a natural disaster, this allows you to check in, and it will allow your program to know that you're safe. And if you do need help, it will offer to connect you to our Team Assist partner, which is AXA. They're our 24/7, 365 assistance partner. So that is something that is on your app, and I do encourage you to use it if you do find yourself in a situation of political unrest or natural disaster. To get into some of the core benefits, you do have a lot of really great benefits on the plan. You have accidental death benefit, which is basically like life insurance. Should anything happen due to an accident, it's a payout that will go to your family. You have $100,000 per accident sickness. You also have mental nervous benefits. So what that means is counseling, really. Outpatient benefit of $2,500. That's basically for your counseling services. So if you need to see a therapist while you're abroad. And then $5,000 inpatient. Once you are admitted, if you are admitted as an inpatient for mental health, we do start the evacuation process. And so those benefits actually will fall under the evacuation as soon as that's underway. I'll get to that in a moment. You also have something called extension of benefits. What that is if something happens while you're abroad and it is first diagnosed or treated while you're abroad on the program, you do get an extension of benefits for up to 30 days. Okay. Now, that if you are seeking additional treatment and you're in your home country while that is occurring, it is going to be limited to $10,000, and it's on a secondary basis. That's how it works. So once you're back in the US, if you are seeking additional care for something that did happen while you were abroad and you are back home, we would be looking for information from your primary domestic insurance first, and and copays and things like that. Then you also have some physiotherapy as well as chiropractic care and specified therapies, which is basically specified therapy could be something like acupuncture. Okay. Physiotherapy, it does require a referral, but chiropractic and specified therapies do not require a referral. And the chiropractic and specified therapies are limited. They're $50 a visit, max 10 visits. versus the physiotherapy, which is going to be fully covered if ordered by a doctor. Accidental dental coverage, that's basically coverage if you were to lose your teeth or damage your teeth due to a covered accident, and that's going to be covered just under the medical portion of the plan. And then you have something called palliative or relief of pain dental, and that's basically a limited benefit for up to $500, up to $250 per tooth. If you have something that happens like you chip a tooth and you're in pain, or you have a new cavity that develops or something like that. You also have coverage for $10,000 in pre-existing condition coverage. So what that is if you do have a pre-existing condition, there is some coverage to assist with those expenses. And then you have emergency medical evacuation, as well as repatriation of return of mortal remains. And you also have comprehensive security evacuation. What that is that's coverage for political unrest and natural disaster. So it's coverage to help get you to safety. And then once you're in a safe location, to get you either back to the program if it's deemed safe, to another location that Western Kentucky might determine is a better fit during that time, or back home. Okay. You also have coverage for team assist. The team assist package is included, and that is basically 24/7, 365 access to our assistance partner for help with things like locating doctors, locating specialists, shipping medication, like those types of things. Okay. Emergency medical reunion, that's $5,000. That is basically coverage for a loved one to come join you at your bedside should you be hospitalized. Okay. And that will help with airfare as well as some meals and things like that. So that is what emergency medical reunion means. And then you also have some other coverage. You have trip delay, which is if you have if your trip is delayed due to one of the many reasons that are outlined in the brochure, including like carrier delay, like weather, that kind of thing, then you can have some coverage while you're waiting to be booked on another flight. The delay just has to be for 12 or more hours. You also have trip interruption, which is basically only really going to apply when you're abroad for like a semester or longer. A shorter term trip, it probably will not. It's really for a round trip air ticket. In the event that something happens, like a loved one, a family member passes away and you need to go home, and then your intention is to return back to the program after. So it leaves your original return ticket intact. Then you also have a trip cancellation benefit / terrorism. And so there are a lot of the language surrounding that is in the brochure. It's not trip cancellation in the sense that it will kick in for any reason. Like if you want to cancel your trip for any reason, there are certain parameters that need to be met. So you're going to want to make sure that you look at that. It's intended to be, these other benefits are intended to be limited. They're not intended to really take the place of some of those other standalone travel plans that do specialize in things like cancel for any reason and interruption for any reason. The real core intention of our plans are really for health and safety abroad. And so these other benefits are limited, but we do throw them in because we feel like they're important and they do enhance the package. Quarantine is our newest addition. That is something that is a lot of people are talking about. It's coverage in case you are put into a mandatory quarantine, and it's up to $1,000 and for up to 14 days. There's no per day limit on that, which is nice. And basically, I'll get into that in a little bit more detail in a moment. Do you have any questions actually before I move?
I do not.
COVID specific benefits and limitations. I just wanted to talk about that real quick because I get a lot of questions on it. So we will cover medical expenses if COVID is contracted abroad. We will cover medical evacuations if COVID is contracted, and if you need to be moved to another location. One thing to note is that evacuations are more difficult to arrange during a pandemic, and that's both for COVID and non-COVID illnesses. The challenge with COVID as a reason for evacuation is that the government of wherever country you're at starts to take over on the process. So our assistance company does not have the ability to call the shots in the same way that they would if it were due to another reason. So if you need to be evacuated due to COVID, there are a lot of parameters that need to be met, and it can take a little bit to be arranged because you actually have to be in a plane that's retrofitted to handle infectious disease. So it's never going to be a simple commercial flight, which there are a lot of evacuations. The vast majority of them do take place on commercial flights with a medical escort. But when it comes to COVID, that's not a possibility at all. And so you do have to keep in mind that, you know, evacuations will require a retrofitted plane, and they are going to be more complicated if it's due to COVID. So that is something to keep in mind. We will cover testing if there are symptoms or exposure, but we're not going to cover testing if it's required for work or school or at the airport. Because it's required, we're not going to cover those types of tests, but we will cover if there's symptoms or exposure. Okay. Vaccines are not covered. I do get that question. I have had questions about people having one part of their vaccine done and then wanting to have the additional one done abroad. That's not actually how it works. With vaccines, you really do need to obtain them prior to travel and make sure that they're all done, because if you're trying to get vaccinated abroad, the availability of getting a vaccine or getting the same vaccine could be limited or non-existent. You just want to make sure that you understand that. A little note here is that if you have an unvaccinated family member and they want to come to your bedside due to a hospitalization, I did mention earlier emergency medical reunion coverage, their status could cause a lot of delays, okay, or complications even with doing so if they are unvaccinated. This is because depending on the country you're talking about, and so it's gonna be a broad range depending on the country in terms of what their own rules and regulations are. But you could have situations where, you know, someone who is unvaccinated who comes to a particular country is not allowed to get in, or they're forced into a quarantine at a hotel and they're not allowed to leave for a number of days. So those are things that need to be kept in mind, that family members need to understand that actually their own status with vaccination can impact their ability to come see you should something happen to you. Okay, and that is something that our assistance company is making sure that we really do understand and are trying to communicate, okay, with our groups. All right. Quarantine specific notes. So this is a different benefit, you know, this is new, and it's a reimbursable benefit. And it's for unforeseen enforced quarantine ordered at the country of destination. Okay. We're not going to cover quarantines that are self-quarantines or quarantines that are known in advance of travel. Okay, so if you know that when you get to a particular location, you're going to be required to quarantine as soon as you get there, that is something that's known in advance, and that's not going to be covered. Okay, or if you are unvaccinated and you go to a place that is going to automatically require unvaccinated people to quarantine, that is not going to be covered. It has to be something that you do not know of ahead of time and is unforeseen. So the most common sort of quarantine claim that we're going to see is if your travel home from the program is delayed because of a positive COVID test. This is based on US government testing and travel regulations. So they are, in this case, the government authority that's calling the shots. So you cannot board a plane back to the US if you test positive within a certain amount of time of departure, and that's going to be based on whether or not you're vaccinated or not vaccinated, the length of time. Okay, so usually it's within 72 hours if you're vaccinated, you have to have a negative COVID test. If you test positive, you are not allowed to get on a plane. That would be a basis for being stuck in quarantine, even if you're not forced into quarantine at that particular location by someone there. You are essentially being forced into quarantine by the US government in this case, because that is their rule and it's non-negotiable. Okay, so you would go to a hotel, you would save your receipts. It's intended to cover sort of out-of-pocket expenses related to accommodations, food, and travel that might be incurred. So you'd want to, save all those receipts and documentation, and then we review that all once the claim is submitted. The definition of quarantine is a period of time during which the insured is forced into medical isolation by a recognized government authority, their authorized deputies, or medical examiners due to the insured person either having or being suspected of having a contagious disease, infection, or contamination while the insured person is traveling outside of the insured's home country. Do you have any questions on that?
No.
So, sorry, additional coverage notes. It looks like I have error on the bullet, my apologies. That last sentence is intended to say the full 2 days. You have a very good emergency medical reunion benefit. It's triggered if you are hospitalized for 2 or more days. A family member can still come to your bedside prior to the second day, but expenses are not going to be considered unless you're hospitalized for the full 2 days. My apology on that first bullet. The security rider is, as I mentioned earlier, political or military events or natural disasters. That's what it's related to. And it also includes a clause for assault or threat of assault. Okay. So this is good. Resources are available if raped or mugged. And that is, even if there's no medical necessity for an evacuation, that actually does come into play. So if something like that does happen, even though it's not per se like a political unrest situation or a natural disaster, we still look at verified physical assault or threat as a trigger there. So you could open up a case with us and we will assist in any way we can. Now, any kind of medical or security evacuation has to lead to basically you have to open up a case in order for benefits to be payable. So we don't cover self-evacuation. So if you evacuate yourself from your location because you weren't feeling well, that's not going to count and it's not going to be covered. You have to make sure you make arrangements with us ahead of time. The brochure that you will have when you are enrolled in the plan contains the full policy wording and all the exclusions. So even though the coverage is very robust, there are limitations, and I definitely encourage you to review the brochure prior to departure so that you understand the coverage fully. Some pre-departure tips. You have to ensure that to the extent that you are able, that your domestic major medical coverage remains in place while abroad. If you do not have a domestic insurance plan, it can cause a lot of complications, specifically around medical evacuations. And this is because US hospitals need to consent to accepting in the US. So if you're abroad and you are going to require a medical evacuation, and the medical evacuation is going to end up landing at a hospital in the US, essentially. So you really need to have that hospital consent to accepting you. And we've had a couple of cases where, because of no domestic insurance being in place, the US hospital did not want to accept that patient. And so it actually ended up leading to a lot of complication and a lot of delay, because it ended up meaning that AXA had to call pretty much like maybe 20 to 30 hospitals before they would find one that was willing to accept that patient. So it can get very complicated. So just understand that. If you have a pre-existing condition, you really need to make sure that that condition is under control prior to departure. If you take prescriptions, you want to arrange to bring them with you. You should check with your doctor and embassy, consulate, to ensure that arrangements can be made, but Team Assist can also help. And I definitely encourage you to reach out to Team Assist if you do have questions about medication, because medication is actually, even though you can readily get medication here in the US, it really might not be available where you're going. And that's especially true for medications that are related to things like ADHD and other psychotropic medications. So those kinds of medications are hit and miss, depending on where you're going. So you want to make sure that you really understand what the limitations are going to be if you have a situation, where you're going to be running out of your prescription because you're not going to be able to have enough. You just want to make sure that you understand that there could be some issues. That's why we really recommend that you involve us if needed. When you are bringing medication, you want to make sure it's in the original container and that it's accompanied by a doctor's note, and that it lists any generic equivalents and explains the need for it. And you should always, always, always pack it in your carry-on luggage. If you require continual monitoring or treatment because of a pre-existing condition, we encourage you to open up something called a continuation of care case prior to departure. And this will ensure that there are fewer complications while you're abroad. And this can, the continuation of care process can help with it can range from confirmation that a specific medication is available and or legal where you're going, to sourcing specialists and arranging for follow-up care. Okay, so if you need a specialist because of your condition, let's just say you have a very specific allergy and you need an allergist, or you have a gastrointestinal issue or something like that, you really want to make sure that you can see someone who can handle your situation adequately. So that's why it's really important to involve Team Assist ahead of time. So we do, Team Assist is going to require authorization. And we have forwarded the necessary forms to the study abroad office. So the study abroad office does have those if you do need them. And what I would say is that you really want to make sure that you contact Team Assist at least 4 to 6 weeks prior to departure with the continuation of care information. And because then it will allow adequate time for research and arrangements. Okay. So any questions so far on any of these things?
So you said to contact the Team Assist 4 to 6 weeks prior.
Yes, you should contact Team Assist 4 to 6 weeks prior and fill out those continuation of care forms if you have a situation that is going to require continual care or monitoring while you're abroad. Okay, or if you have questions on a medication or something like that, you can also just contact them. It may not be necessary, depending on the medication, to go through that whole continuation of care process, because they might be able to give you a pretty simple answer if it is allowed in the country. Then you'll. But otherwise, I would say You know, definitely try to fill out those forms and submit them if you do have something that you know is going to require care.
Okay, thank you.
Claims versus cases, what's the difference? Okay, so sometimes a case can be opened without a claim, and sometimes a claim can be submitted without having opened a case. So there's a difference between these two. Claims are really simple. If you pay for something out of pocket, such as a visit to a clinic for a sore throat or a prescription, a claim form can be filled out and sent to CISI along with all the bills, receipts, and then we will reimburse the insured. A case with Team Assist does not have to be open for something like that. Okay. Other benefits like trip delay and quarantine, those are reimbursable benefits. So you have to just save your receipts and then you submit them once you get back. And then we review upon receipt. You do not need to open up a case ahead of time in order for those benefits to be payable. So you do not have to call AXA and open up a case or email AXA and open up a case. You just simply save your receipts for those types of things. But a case has to be opened for any situation where a guarantee of payment is required, like a hospitalization, or for medical evacuations, repatriations, or security situations. A guarantee of payment is essentially a way for us to pay for a visit so that you don't have to pay out of pocket. And it's going to be most common for hospitalizations. You're typically, a guarantee of payment typically is not going to be issued for something that is really small that you can pay for out of pocket and just save your receipt and send it in. But if you're hospitalized, you absolutely need to open up a case because we need to make sure that you're getting adequate care and treatment. And our Team Assist doctors that are on staff need to make sure that you are, if you need to be evacuated, that those arrangements are made effectively. Okay, so that's why they need to be involved. So any sort of guarantee of payment issue, hospitalization that's going to require, you know, that medical monitoring, and any sort of evacuation, repatriation. So cases should also be opened for situations that are going to require the attention and treatment while abroad. As I mentioned earlier, like when you're filling out that continuation of care form, that is going to end up leading to you opening up a case because you're going to be doing it in advance of travel. Okay. We don't have restrictions in terms of the doctors that you can visit. You can basically go to any provider you like. And there are a lot of resources that are available from Team Assist or online via the portal. So, you know, from within the portal or from within the app, you can look up doctors and things like that. But really, AXA, I would say, is the best place to go if you do need something more specific or specialized. If a provider is willing to direct bill us, you might not need to pay out of pocket. But I think in general, it's good to be prepared to pay up front for acute medical care. So if you have a cold or, you know, something minor, sore throat, that kind of stuff, you should really just expect that you're probably going to just pay for it and then submit a claim form for reimbursement. That's the best way. That way, you know that this could be a possibility and you're not going to be disappointed if you do just have to pay out of pocket and then submit. A lot of providers, they don't really want to do direct billing for small bills. Anyway, it's kind of a little bit of a hassle for them to do that. So they do kind of tend to prefer payment up front for those kinds of things. Okay. Filling out a claim form is really easy. It's a part of all of our brochures. So when you do get your information from CISI, there is going to be a claim form in there. And you can also download it from our website. And you're just going to fill it out and submit. You would email it over to us along with any accompanying receipts. You can also submit it by mail or by fax, but I'm pretty sure that college students today do not use faxes. So I'm thinking email is probably going to be the most common method for you. So, okay, so when you submit via claim help, you're going to receive a receipt of confirmation. Okay, so you'll receive an email back from us saying thank you for your submission. If you send it by fax, we do get that in our fax log, and mail, we do get in our mail log, but you're not going to get a confirmation until it's processed. But claims are typically made pre-COVID times. Claims were made within 15 days of receipt. We do ask that people give more time, because in the era of COVID, everything is taking a little bit longer. Okay, so we do ask that, you know, it can take a little bit longer. It can take more like 20 business days. Okay. So when you're opening a case while abroad, there's some things that AXA, which is our team assist partner, they're going to ask. They're going to want to know, you know, first and last name, some details, what's being requested, brief summary of the request, policy member, like the member number from your ID card, and the location where assistance is requested. So they can be open for emergency and non-emergency cases. There's nothing worse than somebody calling in and saying, I need help, but I don't know where I am. I'm not really sure how you can reach me. I mean, there's all sorts of things. You just really should have some details. Now, it's understood that if you're actually the one getting hospitalized, you're probably not going to be the one opening up the case. Okay, so it's always good to have a buddy. If nobody knows you're in the hospital, it's going to be really hard to help. And so you want to make sure that a friend can open up a case on your behalf, and or that you can reach out to program staff for assistance so that they can open up a case. But number one is that you're always going to want to seek help without delay first. And then once admitted, worry about opening up the case. We're not an ambulance service, so we're not going to drop out of the sky and take you to a facility. You should know where to go. Of course, there are situations where you're in such a location that you're so far from medical care that might need to be the case, where, you know, you would have to reach out and see what options are available. But in general, we are not 911. So you would want to contact, you know, the equivalent of 911 wherever you are. You're going to seek help without delay, and then open up a case. So during a hospitalization, we will work to provide a guarantee of payment so that you don't have to pay out of pocket. Like I said, I mentioned the guarantee of payment earlier. If a payment was already made by you and you're in the hospital, we will work to try to reverse it if we can, or reimburse you as soon as possible. And then we'll try to take over payments from there. Okay. We do have an in-house crisis team that is for staff at Western Kentucky. So Western Kentucky, if a case is opened, they can actually follow up with our in-house crisis team to make sure that they're getting what they need and that everything's running smoothly. Okay. So this information that's on this right here is on your ID cards and stuff. So you don't really need to memorize this or anything like that, but this is the important contact information that's going to be available on your ID card and from within the portal. And that is it for me. Do you have any questions?
Is the cost the one that's on the, how much exactly is the insurance plan?
That gets built into the cost of the program. So, you know, they incorporate that into the program fees. So Katie and John, that's how you guys do it, correct?
Yeah, so it's going to be listed, you know, the approximate cost. It does vary just a little bit by depending on how many actual days you're on site, but within like Teradata in your application, the budget sheet, if you search for the exchange with NCCU, that will show like an estimate of the insurance. And then once we enroll you, which we will do once we pass tomorrow, when you've submitted and, you know, your appeal has been reviewed, you'll get enrolled, and then that amount is billed to your TopNet account. And
Okay.
that's the same for any student who's enrolled in our plan, except for faculty-led programs, which is actually built into the total program cost that's billed to the student's account.
Okay, thank you.
Yeah, you're welcome.
Carolina, where are you planning on going?
Taiwan.
Awesome. Are you in the flagship?
I am not.
Are you studying Chinese?
I am an international business major, and so
Awesome.
we're required to take 3 language courses, and I decided Chinese.
Perfect. Perfect. It's a great place to study it.
Yeah, so we're keeping our fingers crossed that visas and everything are possible for the spring.
I know, day by day, moment by moment.
Yeah.
Okay, so I'll get you an updated PowerPoint, just so you can share it if needed. I just want to correct that small error that I made. Apologies for that.
No
And
worries.
yeah, if you need anything else, just let me know.
All right. Well, again, thank you so much for doing this. And I am sure that more students will view it when we share the recording. So, but again, just
Okay.
appreciate your time. And Carolina, thank you for coming. And, as always, just let me know if you have any questions.
Thank you so much. Have a great day.
Bye.
Thank you.